Archie Williams from the African Dream Academy to do for us the reading of the Warriors Day Proclamation. Put your hands together as you.
Good morning, ladies and gentlemen. My name is Archie Williams. I'm from the African Dream Academy. I live ELW, Painesville, Monrovia, Liberia. I am in the 11th grade class. First of all, before I start, I want to give God thanks. And also, I want to appreciate the program staff and officials for the great opportunity. Thank you. Republic of Liberia, Ministry of Foreign Affairs, Monrovia, Liberia. A publication by the President. Whereas, since the diagnosis of AIDS in 1981, it was continuing to pose a serious problem and threat to the health and well-being of the human race, of which the people of Liberia are no exception. And whereas the citizens of Liberia constitute a vital resource of the nation, and the government is desires to improve the equality of the life its people by propagating and promoting programs and improving their health, well-being, and welfare, therefore by preventing death and illnesses among the entire populace. And whereas Liberia has a generalized HIV epidemic with productive age population showing age prevalence of 2.1%, 2013 LDHS, even though population of 74, significant variation of HIV population exists between and within region and country. HIV prevalence is higher in urban 2.6%, then in rural is 0.8%. Rural, the sub-Saharan region has the highest prevalence of 2.8% among the 5 regions, and Monrovia, Monrovia, and Grand Bassa County have the highest HIV prevalence among the 15 counties and account for about 70% of the urban disease in the country. And whereas the principle of creating awareness of the treatment of HIV in accordance with these recommended by the World Health Organization, who in the United Nations Joint Program on HIV/AIDS on us to educate keep the Liberian people aware of the treatment of AIDS. Whereas the United Nations Joint Program has designed to the first day of December of each year as World AIDS Day, and urges all members countries to execute relevant and appropriate awareness programs in observing of the day. And whereas on December 1st, 2023, the World AIDS Day will be celebrated on the global theme, Let Communities Lead, and the national theme, Community Live with Equality, Diversity to End AIDS. Now, therefore, I, Dr. George Monrovia, President of the Republic of Liberia, have virtues of the authority in the vested, thereby declare and proclaim Friday, December 1st, 2023 as the World AIDS Day to the observed throughout the public as a working holiday in recognition of the enhanced contribution of the United Nations to combat HIV and AIDS. Furthermore, I do call upon the government, ministries, agencies, local and international organizations, and general public to cooperate with the National AIDS Commission to organize and execute appropriate programs benefiting the occasion. Giving on my hand and seal of the Republic of Liberia in the city of Monrovia, County of Monrovia, this 20th day of November in the year of our Lord 2023 of the independence of Republic, the 177. Dr. George Monrovia, President of the Republic of Liberia, by order of the President, Thelma E. Tukan. Miss Thelma E. Tukan, so your active Ministry of Foreign Affairs. Thank you all.
Put your hands together for Archie. Keep clapping. Clap for Archie as he takes his seat. UN Secretary General, what is the message? UN representative.
All protocols observed. Distinguished ladies and gentlemen, good morning. I'm privileged to deliver the message of the Secretary General of the United Nations on behalf of the UN Resident Coordinator. I quote, World AIDS Day arrives at a defining moment. AIDS-related deaths have fallen by almost 70% since their peak in 2004. And the new infections are at the lowest since 1980s. But AIDS still takes life every minute. We can and we must end AIDS as a public health problem by 2030. Reaching this goal means hitting this year's theme, let communities lead. The path to ending AIDS runs through communities, from connecting people to the treatment, services, and support they need. In the grassroots activism, pushing for action so all people can realize their rights to health. Supporting those on the front lines of the battle against HIV is how we can win. That means placing community leadership at the center of HIV plans, programs, budgets, and monitoring efforts. We must also remove barriers to community leadership and ensure space for local civil society groups to take forward their vital work. Above all, we need funding. The AIDS response in low and middle income countries needs over $8 billion more per year to be fully funded. This must include scale-up funding for local programs led by people living with HIV and prevention initiatives led by communities. AIDS is beatable. Let's finish the job by supporting communities to end this scourge in their neighborhoods, their countries, and around the world. Unquote. And thank you for listening.
Thank you. And put our hands together again. Are we clapping soon? Amen. Let's stop that. We can just stop here, right? We can just stop here. Let's put our hands together. Yeah, we need to shut up for two sides. We are celebrating today. DJ. people being here. So we'll be skipping number 7 to number 8. Statement on community leadership, Evans L. Actofi, the Private Coalition.
So we stand on the existing protocol to make this statement on communities-led leadership. Today we gather here to commemorate another celebration of which is a global movement to unite people in the fight against HIV and AIDS. Since 1988, communities have stood together on World AIDS Day to show strength and solidarity against HIV stigma and to remember lives lost. This year, 2023, the World AIDS Day theme is Let Communities Lead. The theme emphasizes the influence of community on the HIV response and global health. The theme is deliberate and has been decided to mark the pivotal impact communities have had in shaping the HIV response. In the UN AIDS report launched on the 28th of November 2023, it urges governments across the world to unleash the power of grassroots communities across the world to lead the fight to end HIV and AIDS. Indeed, with community leading, HIV can be ended as a public health threat by 2030, but only if communities on the front line gets the full support they need from governments and donors. Communities have been the driving force, given the tremendous progress we have made so far. In Liberia, we need to accelerate community-centered design programming to sustain our collective efforts. As a country, we have seen how communities are ready, willing, and able to lead given the intentional approaches that drive sustainable impact. We know this is possible from our experience with Ebola and how quickly we are able to defeat COVID. According to the World Health Organization, communities living with and affected by HIV, networks of people from key populations, and youth leaders have been and continue to essentially progress in their HIV response. They provide essential prevention, treatment and care support services, build trust, generate innovative solutions, promote health, monitor and implementation of policies and programs, and hold service provider accountable. This is why the conversation around development has shifted and recognized community ownership and localization as impactful in a sustainable way. We need to develop a more flexible funding criteria to include communities-led organizations in green and designate a proportion of funding which goes directly to community organizations. We need to ensure that the intervention of less visible community-led organizations are such as always explicitly included in national budgets, even if the data is not yet available. We also need to make structural intervention a condition for funding and task community-led organizations with a responsibility of developing appropriate indicators and targets. This should require regular capacity assessment of community-led organizations applying for funds and ensure contracts oblige them to build the capacity of community-led organizations or groups to receive grant and also support emerging or small community-based organizations as well. Like leaving no one behind, they have to uphold people's rights, work with communities leading and marshal strong political commitment and reliable financial support. This must be our practical focus of today and every day. Our commitment must be an approach that is community-led, inclusive, and empowering. Let community lead, and let community lead with equality and diversity to end HIV. Thank you very much.
you, Ivan. Thank you so much. So we have a selection by the EFL. Selection by the EFL. I'm going to have like, bro, how many players say the one thing? Let me shake it. Let me. Thank you so much. So now we'll be having our testimonies from Liberia Plus. Liberia Plus testimonies. Put your hands together as they walk up. Put your hands together as they walk up.
Praise hallelujah. I just really want to be thankful to God for this day. Today is a day that, remind us to be able to talk to our government and our partners for their commitment towards the fight of HIV and AIDS. So standing before you, I'm John M. Papa, I'm a person living with HIV. I was diagnosed February 28, 2007. So I just really want to be thankful that I remember 10 to 12 years ago, the face of HIV and the face of HIV today is quite different. So I just really want to be thankful to our partners, to our government for their effort, towards the fight against HIV and AIDS. Today, people coming up and be free to disclose their HIV status, it was not easy. But today we want to say thank you ever so much. As we all, listen to the team or reality, let the community lead. We believe that, the community participation will be able to help us fight stigma and discrimination. I was so touched when the first sung the song, the thing I mean, talking. There are many people that do not want to be new outside there. But today, without us standing up to show ourselves and be able to encourage other people, the fight against HIV and AIDS will never be accomplished. So we just really want to say, the community, we say thank you for accepting us. And we're going to make it proud. Because without us fighting HIV and AIDS, definitely we cannot combat this particular disease. So we just want to say thank you ever so much. Your efforts, your acceptance have given us the courage, and we will continue to take our medication. At a time when there was no treatment, there was a fear, and you could see the death in the eyes of our police who are departed this world. So we just want to say thank you that we are here today to remind you also on your commitment that you promised that you will be able to accomplish. So today, we just want to say thank you all so much to the National AIDS Commission, NACB, the Ministry of Health, all our donors and partners for your effort. We believe that without you, today, we could not have been here. So we just want to say thank you. And we hope that, on every Raw AIDS Day, you will be reminded. So, to those who do not know your status, it is better to know our status, and then to us who already know our status, will level you to talk about you on what you want to see. Thank you all so much. May God bless all of us in Jesus' name.
Thank you, Jerome. Thank you for that testimony. So we are encouraging everyone to go outside. If you have the time, after the program, we are doing testing outside. You can just walk outside and go and do your test. Please, it's free of charge. Can you please go outside and do your test one at a time? And I'm encouraging other people that are outside, please come in for the program too, please. If you are not doing your test outside, please come in for the program. Introduction of the guest speaker, Beno Sayon. Beno Sayon, where are you?
Our honorable guests, members of the media, distinguished audience, please allow me to stand on the existing protocol to introduce our guest speaker. Our guest speaker is a certified medical strategic leader, MSL, and an honorary associate member of the U.S. Medical Army Department Center School for International Collaboration. He holds a Doctor of Public Health, DRPH degree from Monrovia University, USA, a Master of Military Science and Leadership from the Nanjing Army Command and Staff College, Nanjing, China, and a Master of Public Health, MPH, from the Continental University in Liberia. Our 2023 World AIDS Day guest speaker is a registered intensive care nurse from the Kingdom of Morocco. Upon his return from the Kingdom of Morocco in 2005, our guest speaker worked with the Ministry of Health at the Liberian Government Hospital in Bikano and attended many HIV and AIDS related training and works before joining the AFL in November 2017. As the AFL HIV Program Coordinator, in collaboration with Community Empowerment Program, CEP, and the DHAPP Program Manager, U.S. Embassy. The AFL HIV Program has been partnering with National AIDS Commission, NAC, and the National AIDS and STI Control Program, NACP, and all non-government organizations, including UNICEF, to meet both national and global targets in the fight against HIV. Distinguished guests, the 2023 World AIDS Day guest speaker has attended many impactful HIV-related training in Liberia and other parts of the world. He obtained a diploma in HIV policy from the Defense Institute of Medical Operations, DIMO, in Taxi, USA, and attended many regional conferences in Senegal, Mozambique, and Ghana. He is a member of the National AIDS, IAS, and attended his first virtual conference held in Munich, Germany. He served as the principal investigator, PR, and for the AFL serial perseverance, the behavioral epidemiological risk survey to determine HIV prevalence in the military. As a public health specialist, our guest speaker is a member of the Global Health Security Network, GHSN, and attended both conferences in Sydney, Australia, and where he was invited to serve as following his ASTRA submission. On his leadership, the AFL HIV program lead the fight against HIV and AIDS among security institutions, and a great prevention, care, and treatment nationally. Distinguished guests, member of the press, it is my pleasure to call on the stage Lieutenant Colonel Dr. Joseph B.N. Koro, Jr., Assistant Chief of Staff, ACO, for Health Services and Program Coordinator for the U.S. Department-sponsored HIV and AIDS Prevention Program, DHAP. Ladies and gentlemen, please welcome our guest speaker, Dr. Koro, your audience.
Thank you so much. Please have a seat. Honorable Theodosius Escoli, Chairperson, National AIDS Commission, Minister Vavi Tule, Deputy Minister for Planning at the Ministry of Health, Dr. Peter Clement, Representative for the World Health Organization here in Liberia, Mr. Jim Wright, UC Mission Director, present, Dr. Jonathan Fumo, Head for NSCP Liberia. Ms. Sandra Rabat, Director, Health Services Ministry of National Defense. Not forgetting my beloved wife, Mrs. Josephine Cohen, among the platform guests. Other platform guests present, members of the 4th Estate, the general audience, ladies and gentlemen. On behalf of the leadership of the Ministry of National Defense and the Armed Forces of Liberia, the gallant men and women in arms, I am honored and privileged to be selected to serve as the National Orator for this year's War is Day Commemoration Ceremony. I stand here not only to represent all security institutions, but as a military personnel, we are part of the vulnerable communities with high rates of HIV infection. I bring you special greetings from our sponsors and collaborators, specifically the Office of Security Cooperation, United States Embassy, that is providing funding for the AFL HIV and AIDS Prevention Program under the PEPFAR initiative, which is fully implemented under the watchful eyes of Mistress Samantha Cardwell. Greetings from the Community Empowerment Program, our HIV program implementers, which is headed by Ms. Lucy Page. Also, not forgetting my hard-working team under the Armed Forces Health Services, who has brought us thus far. Today we gather here to commemorate the 2023 War is Day program, a day of remembrance, reflections, and renewed commitment in the national and global fight against HIV and AIDS. It is a day that allows us to come together as a community to raise awareness, to honor the lives affected by the devastating disease. The global theme for this year's commemoration is Let the Community Lead. And our national theme is The Community Lead with Equality and Diversity to End AIDS. Permit me to take this time to congratulate the National AIDS Commission under the stewardship of Honorable Theodosia S. Cody for empowering our own community's members to lead the organization of this year's War AIDS Day planning and execution. Who are our communities? Our communities are those key stakeholders who are directly or indirectly infected or affected by the HIV and AIDS virus. It is important that our communities, including the Liberian Network of People Living with HIV, LIVNET, Liberia Initiatives for Promotion of Rights, Identity, Diversity, and Equality Pride, the Coalition for Focal Point from government, line ministry and agencies, civil society organizations, religious institutions, traditional leaders, and key community actors to lead the fight on HIV in Liberia. As we stand here today, we acknowledge the progress made in the past, but we also recognize the challenges that lies ahead. Liberia must achieve the 95 UNAIDS global target by 2030. Is this impossible? No, it is achievable. Because other African countries have already achieved this target. According to the World Health Organization Director General, Dr. Tedros Ghebreyesus, during the 2023 International AIDS Society Conference in Brisbane, Australia, mentioned that Botswana, Eswatini, Rwanda, Tanzania, and Zimbabwe have already met the 95 global target. One of the components to the success in these countries are their posture on human rights and abuses that led to their milestone. Botswana recognized that when human rights are protected, fewer people become infected, and those living with HIV and their family can better cope with the disease. Failure to protect the rights of people living with HIV may increase the spread of the virus and worsen the harmful impact in the community and society. When the human rights are respected, protected, and fulfilled on paper and practice, this facilitates universal access to prevention, treatment, reduce stigma and discrimination, and create an environment which promote access to health facilities and other HIV-related health services. Before we strategize to empower our community to lead this effort, let me take this time to tell us some of the challenges that we face as a nation. The 2018 Integrated Behavioral Surveillance Survey showed that HIV prevalence is high in key populations. The results show that men who have sex with men, female sex workers, people who inject drugs had 37.9%, 16.7%, 9.6% prevalent rate, respectively. Also, results from the size estimate for key populations and vulnerable groups conducted in 2017 show men who have sex with men were 74,634. Female sex workers were 163,031. Those who inject drugs were 4,088. Minors were 9,016. And long-distance bus and truck drivers were 3,450. Additionally, the National AIDS Commission website showed an estimate of at least 1,000 new HIV infections and 1,100 HIV-related deaths annually. These numbers serve as a trigger for us to combine our efforts to meet the global target. So, isolating our communities from active HIV response activities is a recipe for failure as a nation to achieve our goals. Furthermore, let us be reminded that since the discovery of HIV and AIDS in the early 1980s, this pandemic has claimed and continues to claim the life of millions of people around the world. It has caused immeasurable sufferings, leaving behind grieving families and shattered communities. However, through our collective efforts, we have made significant strides in the fight against the disease. Advances in research, increased access to treatment, and improved education have transformed the one deadly disease into a manageable condition for many. Yet, despite progress made, we still face formidable challenges. HIV and AIDS continue to affect many people in Liberia, with marginalized communities, women, young people disproportionately bearing the burden. Stigma and discrimination persist, hindering access to testing, treatment, and care. Inequalities in healthcare systems and socio-economic disparities further exacerbate the impact of the disease. As we gather here on this day, we can all agree that the power of the community leadership to lead this fight cannot be overemphasized, because they have the right messages. They are carrying the major burden of the disease. They can better explain progress in their respective lives. It is through these collective efforts, driven by compassion, understanding, and resilience, that we can create a nation and a society free from the burden of HIV and AIDS. It is within these communities that stigma and discrimination associated with the disease are challenged, where support networks are built, where access to essential services are limited. Today, our progress as a nation comes through the dedication and determination of these community groups. So our message today is clear. Let our key community group let our key community participation remain pivotal in the national fight against HIV and AIDS. We call upon all individuals, organizations, and government to recognize the importance of empowering our communities to take charge of this response. By investing in key population groups, we can address the unique needs of different populations, reduce health disparity, and ensure that no one is left behind. Let us continue to prioritize comprehensive and evidence-based HIV prevention programs that reach all corners of our community. We must promote education and awareness about HIV transmission prevention methods and importance of regular testing. By doing so, we can empower individuals to make informed decisions about their sexual health, break the cycle of new infection, and protect themselves and their partners. Additionally, an effective and well-tolerated antiretroviral therapy has transformed HIV in a manageable lifelong condition. Single tablet regimen with a high rate of efficacy and low toxicity are now in widespread use. Nevertheless, there remain large number of people living with HIV who are not receiving or not maintaining therapy in Liberia. So, hearing the community voice is key to the driver of protecting our community. This community-led initiative will play a vital role in advocating for affordable and sustainable healthcare system and guaranteeing the availability of life-saving antiretroviral therapy to all those in need. As we continue to reflect on our achievements as a nation, let us not forget the challenges that still persist. We must address the social determinants of HIV and AIDS, including poverty, gender inequalities, lack of education, human rights, and sustainable financing. By addressing these underlying factors, we can create an enabling environment that supports and prevents the management of the disease. Let us continue to persist on the pressing need to combat HIV-related stigma and discrimination as they continue to hinder progress and prevent individuals from seeking the care and support they deserve. Together, we can make a difference as a nation. In the spirit of community participation, let us join hands, raise our voices, and continue to fight against HIV and AIDS until we achieve our shared goal of an AIDS-free nation. As we focus our minds on the impact of stigma and discrimination and considering our efforts as a nation, let us appreciate the commitment from the government through the National AIDS Commission for organizing the first Stigma and Discrimination Conference this year. Also, on September 1, 2023, I hope I get the date right, the National AIDS Commission, in collaboration with AIDS partners, validated the Zero Discrimination Plan for Liberia, thereby reinforcing the country's commitment in addressing stigma-related issues. According to NAC, this plan also aims to promote equality and ensure that everyone has dignity by advancing inclusive policy in all spheres of life. This initiative was a step in the right direction and commendable. However, until impact is shown through behavioral change, the plan becomes useless. We must empower our community to execute these plans. From our side, the Armed Forces of Liberia has also worked to address stigma and discrimination. Our 2017 and 2022 workplace policy emphasized on personnel behavior towards stigma and discrimination. Today, AFL personnel within the military who are HIV positive can freely participate in both local and international missions. Before I conclude, let me highlight that sustainable financing to HIV response is pivotal to the success of our shared mission. Currently, the national response is highly reliant on external financial resources, which is not sustainable. I want to call on the government to increase budgetary allocations for HIV stewardship to the National AIDS Commission, which will help strengthen partnership with key community groups and the National STI and AIDS Prevention Program, NSCP, through the Ministry of Health for the HIV program implementation. Furthermore, since HIV is a cross-cutting issue, other government ministries and agencies must include HIV response activities in their respective budgets. The allotted funds will empower line ministry and agency HIV focal persons to promote HIV response within their respective institutions. Also, we call for sustainable financing. As we call for sustainable financing through budgetary allotment, we want to emphasize the need for custodians of public funds to avoid diverting these resources from HIV-related activities to personal use. For transparency and accountability purposes, I recommend that the community leadership be involved in the planning and implementation of all HIV activities nationwide. By working together, we can create a future where no one will suffer again from HIV and AIDS, where every person can access the care they need, and where compassion is the order of the day. Let us embrace the power of science. Let us listen to the voice of the community. Let us combat inequalities and ensure laws that promote human rights and dignity. We have 40 years of experience With our 40 years of experience in this fight, we know the barriers. We can do this together. Together, we have changed the way HIV impact lives. Together, we have helped people live longer and happier. Together, we've turned the impossible into reality. Together, we've turned knowledge into innovations and ideas into actions. Together, we can address deep-rooted stigma and mass misinformation. Together, we must continue to push our curiosity and thinking, embracing the sacrifices of our frontline healthcare leaders, our relentless program servers, and our tireless advocate groups. Together, we are the difference, and we can end this epidemic for everyone, everywhere in Liberia. I thank you.
The speaker for the 2023 award is
Keep clapping, keep clapping, keep clapping. Thank you so much. Thank you. Okay, so at this junction,
he was,
I would like to give our scenario before we come to remarks. So I have the master sheet anyway. And then I want to give a little story. I don't stand behind the purple. I let them come in front so that they are so small. When I stand behind, when I see me good, so I let them come in front. So we have this town, and in this town, the town name is prevention, the use of condom. And then two persons were living this town. One is called unwanted pregnancy, and then the others is called HIV. So they was in this town. This day, people came this town to give awareness on how to use condom. And then the town is unique is prevention. Then they keep a condom. So condom is also prevention. And then when you use condom, you are preventing pregnancy, unwanted pregnancy, and then you are preventing HIV. So this day, Papa was in this town and his wife. They said, but today we have to use condom. So they went and took this condom and put it on the coconut bottle. We all know how coconut bottle will go. They put the condom there and then they went into that section. And at the end of the day, they only got pregnant. So, when the prevention message they put boy in this town, one of the old lady and the old girl got the message is I want brainties of the wire with it. What are the body? In Jesus' mighty name. Okay, so now we come to remarks. But before the remarks, I want all to shake us slow. Because Uncle he done. And then I want enter from the National AIDS Commission, she gave a lot of number, Uncle gave a lot of number. So the number said, like everyone else said, because I can see on our faces the expression that we are so frightened. Because these numbers is look like I am HIV positive, but I don't know. And then maybe my fiancé is HIV positive and he or she don't know. So with this, we want to tell everyone else here that we shouldn't be panicked. We don't have to do our test to be able to know our status. And so in doing that, we want for the AFL to shake out their soul, so we can be able to shake us soul and we can remark. AFL? Yes. So shake us soul and I am going to AFL. Then we can remark. Thank you so much. I'm going to have one music that will dance and tell the whole roof. We want to go the whole roof. So we need dancing. Yes. We want to get out. No, I'm going to have to be, I'm going to have to put it back. Organization. Anyone? Faith Gate Organization. For remark, please. Okay, so we call on the Inter-Religious Council of Liberia. Okay, then we call on the One House, UN One House, for remark.
All protocols observed, distinguished invited guests, it's a privilege to speak on behalf of the UN family in Liberia in this important occasion. AIDS is one of the greatest health crises in human history. On this World AIDS Day, we take the opportunity again to reflect on our progress, acknowledge the challenges that lie ahead, and renew our commitment to ending the HIV/AIDS epidemic.